Good afternoon, ladies and gentlemen. Good afternoon, chairpersons and respected members of the faculty. When I was preparing for this talk, I normally sit with my children when they're doing their homework. So the younger one who's in third standard asked me, why do you have to give a talk about being stupid to doctors? Doctors are so intelligent. Now I see a hall which is probably having 1,000 plus senior doctors. All of you are post-MD senior doctors. So I was just thinking how to do this talk. Now, what I'm going to do in the next 15 minutes is take you through just to define what is stupidity, what are the reasons that we are stupid, and how we can correct it. Now, if you go through the dictionaries from Oxford to Webster to online Google, you'll find all these different definitions of stupidity. Silly, unwise, having or showing a great lack of intelligence, marked by or resulting from unreasoned thinking or acting. But if you look at what is stupid, I came across this book and also a couple of other articles by this gentleman. He's Adam Robinson, who was actually instrumental in getting something called the Princeton Review in US in 80s, which was to teach students how to prepare better for exams, and he is a top consultant with regards to other things as well. And he said, stupidity is the cost of intelligence operating in a complex environment. And we every day operate in a complex environment. So an operating theater, an intensive care, a hospital is a complex environment, and stupidity is almost inevitable. So to define stupidity, this is probably the best definitions we have. That is overlooking or dismissing conspicuously crucial information. So that's something important which is sitting in front of us, we overlook or dismiss. So the question now is, have you ever been stupid? Now I'm sure if I ask people to raise their hands as Dr. William Harrop Griffiths did yesterday, I'm sure we'll get a big raise of hands here because all of us have been stupid at some point in life. This gentleman, I don't know how many of you would recognize, is a magician, P.C. Sarkar. So if you have ever been to a magic show, you definitely have been stupid because you don't know what's happening there. You're gone there, they've thrown some tricks at you, and you come out thinking, oh, how did that happen? I was being stupid. But that is benign. Now, as doctors, we should be worried about something much more dangerous, that is being stupid in the hospital. Now, Dr. Senthil showed this slide, and I would like to kind of reiterate this because we don't have much of other data to show that how medical errors can cause deaths. It is probably the third important cause of mortality when it comes to causes of death, and this is data from US and published in BMJ. Now, what are the causes of stupidity and how can we correct it? So the first one which I'll be tackling is something called as being outside your circle of competence. So there are two circles here which you can see. So the one which is blue is what you know, and the other one is what you think you know. Now what you know is a safe zone. You're there in the safe zone, you do what you know, and patients are safe. But the danger comes when you start doing things in the what you think you know zone. So let's take an example. An anesthetist who is well trained, knows how to do a lumbar epidural, attends a workshop and starts doing cervical facet joint injection because he thinks he knows cervical facet joint injection. Ends up with a problem. A general surgeon who has just attended a workshop on laparoscopic surgery comes back, sees a couple of YouTube videos and start doing laparoscopic surgery. The other thing which can cause this problem is outside routine environment. So in the routine environment, such as an operating theater, we know everything. We know where drugs are, we know where the equipment is. So that is what we know, what you know. But you go to the radiology suite and there you think you know. You think you know where the tubes are, you think you know where the drugs are. But when a problem comes up, you are in a big soup. So being in the circle of competence, what you really know is a safe zone. Go outside to that green area and you think you know, there you're in danger. But outside the green zone, you have an orange zone where you think you definitely know that you don't know those things and you normally don't go there. So again, it becomes a safe zone. So this green zone in between is where you need to worry about, and as a person, each of you can map out what are your things that you know and where is your circle of competence. So how do we rectify this? So you define the perimeter, of your circle of competence, slow down in what you do, especially when you're learning, work to expand the circle, like coming to meetings like this. Never fool yourself into thinking that you know something or you're trying something out on a patient. And you have to read and improve the knowledge base. And definitely learn from others' mistakes. The second thing which can cause stupidity is information overload. Now, information overload. Now, I'll just give a couple of seconds for you to watch this monitor. Now, all of you are attentive, you had your lunch, and you're sitting here watching the screen. Now, many of you will notice that there is something wrong on the screen. The heart rate is showing at 200, whereas if you look at it, it probably is not 200. And there are so many different parameters on the screen. This probably is a cardiac anesthetist probably doing a big case, or it could be a general anesthetist who just wanted to play with the monitors and keep as much information as possible on the screen. Now, out of all these numbers, picking up something which is vital might be difficult. Add a cell phone to it, WhatsApp, Facebook, and everything else, and you have a lot of information going into your brain. Now, how do we tackle this? Now, the Anesthesia Patient Safety Foundation in the US come out with these newsletters which are available freely, so I encourage all of you to go through them. Now, this one way back in 2017 looked at mainly distractions in anesthesia work environment. And they came out with some suggestions. Now, one of the important things they came out with was this. They said you should have something called as a sterile cockpit zone. So when you're doing critical procedures such as intubation, putting an epidural, giving a block, you tend to make the area sterile. That is, no phone calls coming in, no disturbance, nobody answering their phone calls, nobody playing music, and things like that. So we can decrease the information overload, especially when you're doing crucial things, by following such steps. The second information overload is the publications. Now, if you look at the number of medical articles published each year, it's going up in an exponential way. So how do you tackle this? Now, this is something which I came across, a simple flow chart of how to handle. So whenever you come across new information, it can be either an intentional search. So you have a case of pheochromocytoma tomorrow, so you go and you search, and then you come out with the article. Or it could be an incidental finding. Somebody sent you an article on email, or it could be a journal club that you attended, or it could be on Facebook. So useful information is then stored, it should be retrieved, and it should be able to cite. So how do we do this? Now, this is a snapshot of our AORA for You app. So what we have in this is we have something called as RSS feeds. So you get the latest of all the journals coming into the app directly, and you can go through the abstracts. And if you're interested, you can probably go to the website and download them. Or you can subscribe to the RSS feeds from whichever journal you like on an app that you probably use on your iPhone or Android phone. Then what do? We save the information. So there are plenty of different platforms available. So this example is Evernote, which you can use on your mobile, on your computer, on your tablet. And you can save information, you can search from wherever you want, you can use it for your teaching. So there are a lot of tools available. And there are other things which you can use to decrease the distraction. So you can take time to reflect, you can decrease your online time, and there are a lot of other options which are available. The other thing which can cause stupidity is stress. Now, this graph was shown by Dr. Senthil, which shows that there is a phase where you will perform with optimum energy and focus. So that is when your demands are high but not too high. And the worst thing is when you reach the end of the graph, which is here, which causes fatigue, exhaustion, and burnout. Now, I would recommend for all of you here who have not read this book to go through this. This gentleman, Matthew Walker, is one of the top scientists in sleep medicine in the world, and his book called Why We Sleep actually looks at importance of sleep and what happens. And in one of the seminal papers that he had published, he shows that lack of sleep will decrease reactivity to every kind of stimulus. So it could be a positive or a negative. So it's very easy to say, slow down, keep calm, be positive, and all these nice words. But how do we manage it? So this is something which is most vital here. So we have 5 important things in our life: work, health, relationship, spirit, which is actually a connect within yourself, and your hobby or interest. Now, basically, we're all juggling these things, all the balls all the time. And if you see this, you'll realize that at any point, there are only 2 balls in the hand, 3 are in the air. So if we can focus on the 2 balls which are in the hand and connect 2 of them at any given point of time, say example, you cycle to work, so you get work and health done at the same time. You probably take your spouse on a walk, so you get your relationship and your health. So you can tie 2 things at the same time and do it well, and therefore probably decrease stress. The other reason for stupidity is rushing or urgency. Now, why do we rush? Human nature is to want to get a job done as quickly as possible. We grew up being told to accomplish as much as we can, and we think we get more time to do other things that might be more enjoyable. So if you look at various, disciplines, you tend to kind of see that rushing is dangerous, people make mistakes, so don't rush, and this is from different disciplines. In our medicine, this gentleman made a big difference to this concept of rushing causing mistakes. So he is Dr. Atul Gawande, and his book, The Checklist Manifesto, which came up and later was adopted by the WHO, resulted in this WHO safety checklist, which I'm sure everybody is using. And doing this will decrease the rushing and therefore decrease the errors and also the problems arising from that. Now, it's not just surgical safety checklist. Even for holidays, there are checklists. So if you're going on a holiday, you can probably download a checklist like this and tick all the boxes and make sure you are fun. Fixation on an outcome. Now, this is a photo that many of you would have seen in the last 1 month. This is a queue going up to the Mount Everest, and I think, if I'm not mistaken, Dr. Mahajan was probably somewhere here. It was at the same time that he was climbing, and the reason why he had problems was he was stuck by the people going up. Now, fixated on the outcome to climb and not taking adequate precautions can lead to these. So the highest graveyard in the world is Mount Everest. It is littered with bodies. And this case in the UK, which happened, this lady, Mrs. Bromley, underwent a sinus surgery, and the anesthetists who were anesthetizing were fixated on the outcome of doing the case under an LMA. And what they didn't do was actually follow the difficult airway algorithm. So they were fixated on an outcome, and the fixation on the outcome led to her death. They couldn't ventilate her after some time, the airway was not manageable, and she died. So fixation on an outcome is not good. So here I would like to say that there are algorithms, and you probably need to check on that and follow them. Being in a group where social cohesion comes into play. Now, teamwork is important, but at the same time, social cohesion means the willingness of members of a society to cooperate with each other in order to survive or prosper. So just to give you an example, a patient with upper back pain reports to one of his friends, who's a senior doctor. Now this doctor, because he thinks it's upper back pain, which is so severe, thinks it's an aortic aneurysm dissection. He calls up the ER and tells him that, oh, my friend is coming in, probably he's having an aortic dissection. Now, as soon as the patient enters the ER, nobody is thinking of anything else but aortic dissection. They do an ECG, but it is not seen. And they shift the patient immediately to the CT, where the patient arrests. Now, only when they see the ECG, they realize that it was actually a massive MI. So what happened here is, listening to the person who has given the information, there is social cohesion which is playing, and you tend to take that information without seeing what the other valid points are on the floor. The next one is being in the presence of an authority. Now, airline industry is something where we have learned a lot from with regards to safety. And if you look at one of these accidents which happened in 2003, it says that the first officer either did not detect that the aircraft was at an extreme roll and pitch attitude, or having identified, was inhibited from bringing this to the attention of the commander. Now, this is where safety comes in, especially when we do regional anesthesia. So somebody injecting the drug doesn't realize it's very tight to inject, or he's not probably telling you that he picked up too much of the drug. So if you have a subordinate who doesn't speak up, then you will end up being stupid. Now, talking about stupidity, if we are not in the presence of an authority, we think we are the authority. That is the worst. So this is a graph which shows how our thinking goes when we start learning something. So whenever we start our post-graduation, the first after 50 spinals, we are on what we call as the peak of Mount Stupid. So we think, oh, it's after all a spinal. I just need to put a needle in the back, there will be CSF. Then you will reach a phase of 4 or 5 months when every spinal becomes difficult. And then you reach, after 20 years probably, on the plateau of sustainability. So, ladies and gentlemen, it's not only 7 reasons in each, but if they start playing together, like if you are stressed, if you're rushing, you're not in your environment, and your information overloaded, then the chances of being stupid or acting stupid is very high. So I'll just leave you with this one last slide, which was the first cartoon strip of Calvin and Hobbes, and I'll just let you read it, and that's the end of my talk. Thank you.
Thank you, Dr. Murali. It was a wonderful, exciting talk. Dr. Bala sir.